This session on the gluteal region will cover the deep muscles.
Hello, my name is Richard Fernandez. I'm one of the anatomy lecturers out at Bundura teaching anatomy.
The deep muscles of the gluteal region are piriformis, obturator internus, superior and inferior gemellus, and quadratus femoris. It's interesting to note that the tendon of obturator internus along with the two gemelli are combined to a common insertion. They function as a group of three, hence they're also called tricep coxae, the tricep muscle of the hip. Here I've included obturator externus. It's technically not a muscle of the gluteal region. We'll also look at the actions of these muscles, which is generally lateral rotation, and how they function as dynamic ligaments.
The deep gluteal muscles are all located deep to gluteus maximus. Here you can actually see them. Best landmarks to use to orientate yourself to it would be the medial border of gluteus medius and minimus, laterally, the sacred tuberous ligament, medially, the greater sciatic notch, superiorly, and the ischial tuberosity, inferiorly.
It's always good to start with piriformis because it's a wonderful landmark. You can see how it exits the greater sciatic foramen and traverses down to insert onto the greater trochanter. Its origin would be the ventral surface or the anterior surface of the sacrum itself. Here we can see obturator internus, or more correctly, the tendon of obturator internus. The actual muscle belly lies on the inside of the obturator foramen. However, it converges to exit the lesser sciatic foramen, traverse laterally, and insert onto the greater trochanter of the femur. Going back to this diagram on the left, it's always good to find the tendon of obturator internus so we can then identify the superior and inferior gemelli muscles. So once again, here they are, superior gemellus and inferior gemellus. Notice they're originating on the ischium, superior and inferior to obturator internus, and inserting onto the greater trochanter. You can see clearly how these three muscles can be grouped together and will function together, hence tricep coxae. Here we can see obturator externus. It's originating from the external surface of the hip bone, but it's wrapping posteriorly to travel with the other lateral rotators and insert on the greater trochanter. Remember, obturator externus is not a muscle of the gluteal region, it's a muscle of the medial thigh, but it still functions as a lateral rotator. Finally, we can actually see the quadratus femoris muscle. It's the most inferior of the lateral rotators, and it's named according to its shape, in that it's quadrate. You can also see that it crosses the hip joint posteriorly, originates from the ischium, and inserts onto the intertrochanteric crest.
Now I'm going to present to you the action of the deep gluteal muscles, the lateral rotators. Just to point them out, you should recall piriformis exiting the greater sciatic foramen, the tendon of obturator internus exiting the lesser sciatic foramen, the gemelli, gemellus superior, located superior to the tendon of obturator internus, gemellus inferior, located inferior to the tendon of obturator internus, and quadratus femoris. Now remember, because they are short and because they are very close to the hip joint, they make very good lateral rotators, which you can see here.
All the gluteal muscles are very important for walking in everyday life. You've seen how gluteus maximus extends the lower limb, and how gluteus medius and minimus not only abducts the lower limb but supports the pelvis. Well, here, the lateral rotators and the medial rotators play a very important role. Here we can see the action of how the medial rotators would propel the pelvis. Because they cause the femur to medially rotate, if that femur is fixed, it would actually then have a converse action of pulling the pelvis. Remember open chain versus closed chain actions. So the medial rotators actually help to propel the pelvis anteriorly. The lateral rotators work in a similar way. Once the propelled limb advances and then steps down, contraction of the lateral rotators of the opposite side which helps stabilize the foot and keep the feet parallel. The accessory actions of the lateral rotators are basically there to stabilize the hip joint. They act as the rotator cuff of the hip. Rotator because they allow for rotation, and cuff because they help secure the femoral head inside the acetabulum. It's for this reason that they're called dynamic ligaments. Dynamic refers to the fact that they are in fact muscles, but they must contract, so they use energy to perform this supportive role. Now you should stop and attempt activity 5. Try and draw and label the deep gluteal muscles on the diagram provided, and also describe their location and action. Now we can finish off and cover the nerve supply of these lateral rotators. Here we can see piriformis. Remember, it originates from the anterior surface of the sacrum, so the nerves in that position would be the anterior ventral rami. So piriformis is supplied by ventral rami from the sacral plexus. Over here, on the right diagram, you can see the tendon of obturator internus, superior gemellus, and inferior gemellus. Remember, obturator internus exits from the lesser sciatic foramen. The nerve supply is quite easy. All you have to understand is that there is a nerve to obturator internus. It supplies it and the muscle above it, superior gemellus. A similar concept can be applied to quadratus femoris and inferior gemellus. There is a nerve to quadratus femoris which supplies it and the muscle above it, inferior gemellus.
Now I'd like to give you an exercise to do to help prepare for your flag races. I'd like you to label the structure the flag is attached to via blue tack. Here we're going to start with an anterior view of the pelvis. You can see flag A attached to a structure. As a rotator, you can start to see flag B attached to a structure, and flag C also attached to a structure. I've also placed these flags on the skeleton without the muscles to help you orientate yourself, and I've attached an additional one. So starting anteriorly, flag A, flag B, flag C, and here's the additional flag D.
This concludes the session on the deep muscles of the gluteal region.